Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Substance of abuse and their intoxication features. Firstly, we are looking at the alcohol. So intoxication of alcohol can lead to the blackouts as well as the nystagmus, and there is also slurring of the speech. Next, we look at the benzodiazepines. So intoxication leads to the lethargy as well as the drowsiness. Then we look at the opioid. There's opioid or the heroin. So both have a similar thing. So it leads to intoxication, leads to the euphoria as well as a depressed mental status. Next, it also leads to the meiosis and the respiratory depression as well as the constipation. Next, we look at the nicotine and tobacco. So the nicotine and the tobacco intoxication leads to there is something known as a biphasic pattern. So why is it biphasic? Because in initial part it behaves differently. So initially the early symptoms, it includes the vomiting as well as the hypertension. Next, also the tachycardia. So then we see the later stages. Later it results in the depressive symptoms. So depressive symptoms, that is of the hypotension and the bradycardia. So then we move on to the cannabis. So in case of the cannabis, the intoxication leads to the increased in the appetite as well as there is euphoria. There is the conjunctival injection. Next, there is dry mouth. Associated with, there is panic, there is synesthesia, there is impaired time perception, as well as there is a motivation syndrome as well as run amok and the flashbacks.